Hello, everyone. Thank you for joining us today for a new session as part of the WHO FCTC Hub for the Global Knowledge Hub on Waterpipe Tobacco Smoking. This is part of the webinar series that was launched in 2018. Before we start, let me just remind you or explain to you if you're joining us for the first time. My name is Tamara Lutfi. I'm here to help you through this webinar. You are automatically muted when joining the session. If you have any question or comment, you can either send us your questions directly using the panel, the toolbar on the right that says questions, or you can use the raise your hand button. And once we open the floor for discussion after Dr. Salloum's lecture, we'll be taking your comments directly. So today's session is on the economics of waterpipe tobacco smoking, and our presenter, Dr. Salloum. Thank you for joining us today, Dr. Salloum. Dr. Salloum is an assistant professor in the Department of Health Outcomes and Biomedical Informatics at the University of Florida College of Medicine, and a member of the University of Florida Institute for Child Health Policy and the University of Florida Healthcare Cancer Center. He is an economist with expertise in tobacco control, implementation science, and cancer care quality. He is the recipient of 2 fellowships from the U.S. National Cancer Institute, the Healthcare Systems Research Network, Cancer Research Network Scholars Program in 2015, and the Mentored Training for Dissemination and Implementation Research in Cancer 2016. He is currently the co-principal investigator of the Eastern Mediterranean Consortium on the Economics of Waterpipe Tobacco Smoking, a project that is sponsored by the International Development Research Center and Cancer Research UK. Dr. Salloum currently serves as a member of the American Academy of Pediatrics Tobacco Consortium Expert Panel, as chairperson of the Global Cancer Research Special Interest Group of the American Society of Preventive Oncology, and as an advisory committee member for the Global Health Network of the Society for Research on Nicotine and Tobacco. Thank you for joining us today, Dr. Salloum.
Thank you, Tamara, for the kind introduction. Before I start, I want to thank the American University of Beirut and the Waterpipe Tobacco Smoking Knowledge Hub for the opportunity to participate in this webinar series. Really want to acknowledge the role that the American University of Beirut has done in leading the global research on waterpipe tobacco smoking that has culminated in their designation as a WHO knowledge hub in the last few years. I'm really excited today to cover an important topic, which is the economic aspect of waterpipe tobacco smoking. And what I'd like to be able to cover in today's presentation is I'll start with a background on the economics of tobacco, and then I'll transition to discussing the rationale for tobacco taxation and the types of tobacco taxes before narrowing in on the economics of waterpipe smoking specifically and discussing some ongoing work and future directions with our team. So I apologize first to the economists in the audience, but I thought it would be appropriate to start with a brief economic background of the context of tobacco and smoking. So in terms of examining the costs of smoking and tobacco in general, economists have examined two broad categories of costs. There's what we consider to be direct costs. These are directly associated with the consumption of tobacco, and these are costs that are directly attributed to smoking and tobacco use that lead to a reduction in existing resources. And within direct costs, there are two subcategories. We have direct healthcare costs that are attributable to smoking and tobacco use, And there are also direct non-healthcare costs that are associated with the smoker expenditures that the smoker has, whether they are things like transportation to a clinic or time that family members spend in providing care for the smoker. There are also significant indirect costs associated with smoking and tobacco use, and these are usually associated with reductions in potential resources. So things like lost productivity of the smoker due to disease or due to premature death directly attributable to tobacco use or smoking. And if we examine tobacco and smoking from a societal perspective, there are additional costs above and beyond the costs that are borne by the smoker himself or herself. So additional costs from an economic perspective include costs to society that are borne by non-smokers. So things like costs related to secondhand smoke are examples of what in economics we consider to be external costs. These are costs for a third party that is not engaged in the smoking behavior, but yet may have healthcare costs associated with exposure to secondhand smoke. There are additional costs that we covered on the previous slide. These are indirect costs, also borne by the non-smoker, so family members of the smokers that have to pay out-of-pocket costs or have to provide caregiving to a smoker once they experience a disease or illness episode. And additionally, there is what economists refer to as an internality. So there's the externalities, which are costs borne by a third party who's not a smoker, but internalities are actually costs that are attributed to the smoker. However, these costs are above and beyond the expenditures that the smoker is spending on the behavior of smoking. So these internalities are things that are attributed to the fact that a smoker may not be acting rationally, or in the present while they're deciding to smoke may not be appreciating the full costs of smoking, which include downstream costs. So internalizing these costs is also important to consider when capturing the full cost of smoking or tobacco use. So there have been studies to examine the costs of tobacco consumption worldwide. And the most recent study that was published in 2017 by Goodchild and colleagues estimated the worldwide economic cost of smoking at $1.4 trillion, or just under 2% of the world's annual gross domestic product. And these costs include healthcare costs at a ticket price of $422 billion, and also included indirect costs from tobacco-related diseases at $357 billion, and an additional $657 billion associated with premature death worldwide. Now, we're focusing on waterpipe tobacco smoking in this presentation, which primarily originated in, if we think about the WHO regions, it primarily originated in the Eastern Mediterranean region. And this is an important region in terms of tobacco use worldwide. If we look at projections made by the WHO, even though the Eastern Mediterranean region may not have had a huge share to the overall cost of tobacco based on historical estimates, however, the projections show that the Eastern Mediterranean region is well on its way to becoming, to having the highest prevalence rates within the next 5 years. Within that region, there have been very few studies that have examined the economic costs of tobacco consumption. One such study was conducted in Lebanon in 2008 and estimated the economic burden of tobacco use at $327 million per year, or just above 1% of gross domestic product in Lebanon. This included direct and indirect costs for diseases caused by tobacco, estimated at over $100 million for tobacco-related diseases, and about $65 million for premature death associated with tobacco in Lebanon, in addition to about $14 million in environmental costs, things like fires associated with smoking and waste management. So next I'll transition to why tobacco taxation is recommended or used by governments, and so we'll discuss the rationale. And I'll start by a historical perspective. So tobacco taxation has been around for, the notion of tobacco taxation has been around for over 250 years now. It really started with Adam Smith, a Scottish economist, and who authored The Wealth of Nations. And The Wealth of Nations is considered a foundational text in the field of modern economics. So the concept of taxation was widely discussed in The Wealth of Nations, and so it's not a new concept. It's been a well accepted concept, and in The Wealth of Nations, I'll read this quote: "Sugar, rum, and tobacco are commodities which are nowhere necessaries of life, which are become objects of almost universal consumption, which are therefore extremely proper subjects of taxation." So the notion of taxation is widely accepted by governments worldwide, and has been for many years. And the main rationale for governments to engage in tobacco taxation is the efficient revenue generation that it provides. So this has been the primary motive historically, and it's still true today that tobacco taxation is a reliable source of revenue for governments. And it's also provides a good rationale for low and middle income countries, where historically there's been a low share of tax and price in those countries. The other reason why this works is that smoking and tobacco use in general has relatively inelastic demand, whereas you raise the price of tobacco, the response is lower than when you compare raising the price of other commodities in the economy. And there's also the notion that is closely tied to that, is that there are typically few producers of tobacco products and very few close substitutes. There are many examples from around the world showing the relationship between raising prices and raising taxes on cigarettes specifically and tax revenues. Here's one example from the Ukraine, which engaged in very aggressive taxation of cigarettes recently, and was able to increase the excise rate on cigarettes tenfold in less than 10 years. And during that same period, the Ukraine saw a increase in tax revenues of about sixfold. The other rationale for taxing tobacco products is to promote public health. This has been an important motive for higher income countries. and it's becoming increasingly an important factor in low and middle income countries. It's based on substantial and growing evidence on the effects of tobacco taxes and prices on reductions in tobacco use. This is particularly effective among young people, among the less educated, and among low-income populations. And in fact, in a lot of high-income countries, in many of these high-income countries, some of the tobacco tax revenues are used by governments to directed by governments towards public health programs. Here's an example from the Philippines over the last 2 decades. If you look at the relationship between the price of cigarettes and the consumption of cigarettes, you almost see a mirror of the trends over that time period, and showing that taxation of cigarettes has been a very effective policy in reducing the consumption of cigarettes. Another example is from the United States, where some of the tobacco tax revenues have been directed towards public health programs. In this case, you see that at times where either the state tax increased or the federal tax increased on tobacco, there was a spike in quitline calls or calls to the quit line for that month. A less salient reason for taxing tobacco is to cover the external costs of tobacco. Again, this is the notion of externalities is more common among economists and is less widely understood or popular among the wide population. So it's a less frequently used motive to advocate for tobacco taxation. However, this is the societal costs associated with tobacco use are significant above and beyond the costs that are borne by the individual smokers, and this provides an important rationale for considering tobacco taxation. So an example from the United States, this is from the 2014 Surgeon General's report, showing that an estimate of the total costs of tobacco use in the United States are approximately $320 billion. However, the direct costs borne by the government and smokers themselves is only a fraction of the total cost of tobacco use, suggesting that there are significant external costs that are borne by society and not covered by individual smokers. An additional rationale associated with these externalities is the impact that tobacco has on poverty, and this has led the U.S. National Cancer Institute and the World Health Organization to propose a model or framework for the vicious cycle of tobacco and poverty, suggesting that there's a significant impact on the poor from spending on tobacco products, leading to the primary breadwinner getting sick, which also leads to additional costs on this poor family, and then further down the road leading to premature death. Family falls into poverty, and then as the family climbs out of poverty, the vicious cycle starts again with additional tobacco consumption and an additional cycle of poverty. So this framework was presented in a special monograph by the National Cancer Institute and the World Health Organization that covered the body of evidence on tobacco taxation and the economics of tobacco to date. This was published in 2016 and concluded that a substantial body of research, which has accumulated over many decades and from many countries, shows that significantly increasing the excise tax and price of tobacco products is the single most consistently effective tool for reducing tobacco use. So we'll move on to types of tobacco taxes. This is, again, most of this evidence comes from the context of cigarettes, which has been the dominant product over the past century. So there are a variety of tobacco taxes to consider for governments. One class of taxes are more broadly applied, so they apply to other consumer products. They're not specific to tobacco products, things like sales taxes and value-added taxes. These are not considered regulatory tools for tobacco control because they apply to other commodities in the economy. And then the second class is excise taxes, or taxes that are specific to tobacco products. And they include several subcategories under excise taxes, such as specific taxes and ad valorem taxes. So within excise taxes, there are several structures. The most common are specific excise taxes, which are taxes that are levied based on weight or volume of the tobacco product. And the advantages of applying specific excise taxes are that they tend to reduce the price gaps across different products. They tend to deter tax avoidance. They are easy to administer by governments, and they provide a stability in terms of tax revenue. However, one disadvantage of using specific tax structures is that when a country experiences inflation, the effect of these taxes tends to erode as inflation mounts. The other alternative is the ad valorem tax, which is based on the value of the product, the monetary value of the product. The advantages of using ad valorem structures are that they tend to adjust with inflation. As the price of cigarettes goes up with other products in the economy, the ad valorem tax increases, and they impose higher taxes on higher priced products, which are usually consumed by higher income people in the economy. The disadvantages of using an ad valorem tax is that they lead to greater price variations across tobacco products, which these variations incentivize the industry to avoid paying taxes. One example is by using discounts on products, so this reduces the taxes, which encourages switching by consumers to lower priced products, and it also drops the tax revenues that are levied by governments when the prices of the products drop. There are other schemes that have been proposed. One example is to levy excise taxes based on the nicotine content. This is currently being considered for e-cigarette products where nicotine is a key ingredient in e-cigarettes. However, this may not be as applicable or relevant to waterpipe smoking or other combustible products where there is significant more harm from the constituents that are included in the tobacco product. Among the two structures, specific taxes are preferred to ad valorem taxes for the advantages that were discussed on the previous slide. In reviewing the different structures across the world, there's empirical evidence for countries that use specific excise taxes show a clear advantage in terms of raising the price of cigarettes, and this advantage stands over ad valorem excise tax structures, as well as countries where they use a mixed system of specific taxes and ad valorem taxes. So clearly, excise taxes that use a specific structure are preferred for the reasons that we discussed. One example that I'll point out is Lebanon, where an ad valorem excise tax is used, and it results in relatively low prices for tobacco products in that country relative to other countries in the region that use other tax structures. So based on a lot of this evidence, this is also reiterated in the synthesis of this evidence, and the conclusions are also discussed in the guidelines for implementation of Article 6 of the WHO Framework Convention on Tobacco Control. It mentions that countries should take into account both price elasticity and income elasticity of demand, as well as inflation, to make tobacco products less affordable over time in order to reduce consumption and prevalence. Having regular adjustment processes or procedures for periodic evaluation of tobacco tax levels, and parties should implement the simplest and most efficient system that meets their health and fiscal needs with the fewest exceptions, and taking into account their national circumstances. From a budgetary as well as a health point of view, implementing specific or mixed excise systems within a minimum specific tax floor, as these systems have considerable advantages over purely ad valorem systems. And when we're talking about other tobacco products, non-cigarette tobacco products, the recommendation is to avoid negative consequences such as product substitution or an increase in illicit trade. All tobacco products should be taxed in a comparable way with a similar tax burden, and should be accompanied by strong policies and measures against illicit trade in tobacco products. So again, the evidence so far is very strong in support of taxation of tobacco products. This evidence comes from a wide range of countries from across the world. Over half of the countries of the world, there's been studies showing that taxes on cigarettes are an effective tool for reducing consumption, increasing revenue. And as we discuss other products, there is less evidence there's less empirical evidence on the relationship between taxation and demand for these products, simply because these are products that are usually disproportionately consumed in low and middle income countries, where there has been less data available to study these phenomena. So a recent review by Muhammad Jawad and colleagues concluded that there is sufficient evidence. This review has looked at the price elasticity of demand for non-cigarette products overall. There was perhaps only one study that focused on waterpipe tobacco smoking, but nonetheless, the study concluded that there's sufficient evidence in support of effectiveness of price increases to reduce consumption of non-cigarette tobacco products, as it is for cigarettes. Positive substitutability between cigarette and non-cigarette tobacco products suggests that the tax and price increases need to be simultaneous and comparable across all tobacco products. So moving to the context of waterpipe tobacco smoking, we had suggested in 2016 a regulatory framework that really tries to address the unique aspects and the unique context of waterpipe tobacco smoking that makes it very different from cigarette smoking and other tobacco products. And some of this involves the fact that currently, as it is consumed, waterpipe tobacco is not a standardized product. There are less standard, if you compare it to cigarettes, there are less stringent standards in terms of manufacturing and promoting and marketing the product. The packaging varies significantly. The weight, there's variations in weights within the product, and the content of each product are not well regulated and are not well standardized by industry. So that produces challenges in terms of regulation. There's also the aspect of waterpipe tobacco being consumed largely in cafe settings where the consumer is not directly exposed to the tobacco product and does not directly purchase the tobacco product. So creates other challenges in terms of addressing the behavior of waterpipe tobacco smoking. We have done preliminary survey studies to document some of these patterns. A recent study by our team examined waterpipe patterns by university students in several countries in the Eastern Mediterranean region. We have been able to show that a significant amount of tobacco smoking or waterpipe tobacco smoking occurs in commercial establishments, again suggesting that the consumer does not directly buy the tobacco product. And we've looked at trying to document the price variations in terms of commercial consumption in cafes of waterpipe products, as well as variations in tobacco packet prices when the consumer actually engages in purchasing the product directly for home consumption. We have also conducted experimental studies. We have conducted discrete choice experiments that examine the demand for waterpipe smoking. The first one that we did was conducted here in the United States, again with the university student population. And we try to focus on the context of the cafe or commercial establishment where a lot of consumption happens among university students. And in this experimental study, we captured several attributes associated with waterpipe tobacco products, including the price. So we presented this to participants in a context of a cafe menu and studied behavior that way. And what we found out was that waterpipe tobacco is not different, or the demand for waterpipe tobacco isn't any different from the demand for cigarettes in terms of price. There is a inverse relationship between the price and demand for waterpipe tobacco smoking, and this carries over when you look at differences by gender, when you stratify by gender in terms of males and females, and also in terms of dual users of cigarettes and waterpipe, and exclusive users of waterpipe smoking. This relationship carries over regardless of the subgroup that we examined. We have done similar DCE studies, or discrete choice experiments, in the Eastern Mediterranean region. And again, we see the same relationship between price and demand, suggesting that the price, regulating the price of waterpipe or increasing the price of waterpipe is an effective regulatory tool to control the demand for waterpipe smoking in a region where that has the highest prevalence of waterpipe smoking worldwide. We are using this preliminary evidence and building upon it in a recent study that is ongoing. We have a consortium to study the economics of waterpipe tobacco smoking. This is a study that has been sponsored by Cancer Research UK and the International Development Research Center in Canada, part of a worldwide initiative that includes 7 different projects worldwide. So we're proud to be leading this project with Rima Naash from the American University of Beirut, who is PI of this project, and I'm also proud to be a co-principal investigator of this project, which includes several partners. In addition to the American University of Beirut, we're working with the Knowledge to Policy Center at AUB, as well as the Knowledge Hub, and partners from the region. We have Birzeit University, in addition to Jordan University of Science and Technology and Ain Shams University in Egypt. And the goal of this project is to generate the evidence that is currently lacking on waterpipe tobacco smoking demand and the economics of waterpipe tobacco smoking. We are in the field right now conducting household surveys to collect information on the price elasticity to be able to estimate the price elasticity of demand. So we're capturing information on consumption of current and past consumption of waterpipe tobacco products, cigarette products, and prices paid by consumers for these products in order for us to estimate the price elasticity of demand for waterpipe tobacco smoking and cross-price elasticity between cigarettes and waterpipe. We also want to be able to model the impact of fiscal policies for waterpipe tobacco control on smoking rates, healthcare costs, and public revenues. So the previous work that has been done at the American University of Beirut to model the impact of fiscal policies has been primarily or broadly done on tobacco consumption in general, and due to the lack of specific information on waterpipe smoking patterns in the country. So we want to be able to build on that prior work and be able to provide more specific estimates of the impact of waterpipe smoking on the health of these populations, as well as on the economy, and be able to make that information available to governments and decision makers. And our third aim is to develop a toolkit to guide researchers conducting analysis on the economics of waterpipe tobacco smoking, again, given the unique context of waterpipe tobacco smoking. And finally, we want to be able to disseminate this knowledge that we're creating about the economic impact of waterpipe tobacco control policies to government agencies, policymakers, and advocates. And we have several stakeholders involved in this project from all of these different groups. And again, as I mentioned, we have made significant progress in terms of data collection with our household surveys in the 4 countries involved, and we look forward to producing or generating this evidence specifically linked to waterpipe smoking, and hopefully we'll have the chance to present our findings in a future webinar through the Knowledge Hub. Within these surveys, we also are building on prior discrete choice experiment work that we have done with an innovative twist. We are currently using volumetric choice experiments, which is an innovative twist on traditional discrete choice experiments that allows us to capture, in addition to the trade-offs that are made by consumers in terms of different products, it allows us to capture the quantities which that a consumer would be choosing based on the prices available. And this is important for estimation of the price elasticity of demand, which is the relationship between the price and quantity consumed, but also allows us to capture cross-price elasticity of demand between cigarettes and waterpipe tobacco products, in addition to cross-price elasticity or substitution within different options of Waterpipe tobacco, whether it's premium Waterpipe tobacco or discount, which are really influenced by ad valorem taxes in countries like Lebanon, but also substitution between home consumption of Waterpipe tobacco and consumption at commercial establishments such as cafes. So here's an example of a question that we ask on our household survey that presents 8 different options of tobacco products that are typically consumed in this population, and we in the experiment we have multiple iterations that cover a wide range of prices and product options in order to construct a clear estimates of the demand for these products using discrete choice experiments. So as I mentioned, we are presently in active data collection. We hope to have interesting results to share with you soon. And before we move on to the Q&A section, I just wanted to close with some remarks that are actually conclusions from that report by the National Cancer Institute and the World Health Organization on the economics of tobacco in general, some of which were covered in this presentation, others were not, but you could, if you are interested in learning more about these concepts, I invite you to access the report online. I provide the citation here. So in closing, the global health and economic burden of tobacco use is enormous and increasingly borne by low and middle income countries. High income countries are seeing significant progress in terms of reducing tobacco use rates, whereas unfortunately in low and middle income countries, tobacco use rates are still on the rise in many of those countries. The failure in the markets for tobacco products leading to significant externalities and societal costs provide an economic rationale for governments to intervene. And there's a common misconception that tobacco control does harm economies. This is a misconception that is peddled by industry groups. However, if we look at the global evidence for this, there is evidence against that notion. This is summarized again in this NCI WHO report, and there's also the advantage of routing a lot of this tobacco revenue towards public health programs and economic programs to substitute either working in tobacco agriculture or hospitality industry with other productive sectors of the economy that do not have these significant external costs. And then finally, I'll close with the fact that tobacco control reduces the disproportionate burden that tobacco use imposes on the poor. So again, I want to thank you for your attention, and I'm happy to answer any questions and also answer your questions outside of this venue by email.
Thank you so much, Dr. Salloum, for this very interesting and informative session. It's great to see all the work that's been going. So I'm going to ask our participants to either send in their questions using the toolbar on your right, or feel free to click on raise your hand so that we unmute your microphone and you can directly address your comment to Dr. Salloum. All right, so I think this has been a clear presentation.
No questions?
No questions at all.
Okay,
We also
well, I want.
welcome any comments if anyone wants to add any comments. Please go ahead, Dr. Salloum.
Okay, well, I just wanted to thank you, Tamara, for hosting the webinar, and thank the American University of Beirut and the Knowledge Hub for providing this opportunity, and thank you for attending, and please reach out by email if you have any further questions after this presentation. Thank you so much.
Definitely. Thank you so much, Dr. Salloum. Thank you everyone for joining. The recording for the session will be will be on the website within the coming few weeks. And of course, you can send in your comments to Dr. Salloum or to the email that you received when you registered for this webinar, and we'll forward them to Dr. Salloum. Thank you. Goodbye.
Thank you.